Hi, everyone. We're just going to wait 1 minute before we get started here. Great. Welcome, everyone. We are excited to host today's webinar about the Kansas Juvenile Justice Stepping Up Project. And we're going to get started. It's 3:01. So next slide, please. I'm Stephanie Uberall. I'm the Deputy Program Director here at the Council of State Governments Justice Center. The Council of State Governments Justice Center is a national nonpartisan nonprofit where we work to improve outcomes for people involved in the justice system and promote stronger public safety. We have multiple divisions here, division focused on behavioral health, corrections and reentry, justice reinvestment, and a research division. And this Juvenile Justice Stepping Up project is led by our Behavioral Health Division and our Juvenile Justice team, so cross-division project. And with me today, we have Megan Davidson, who's our Program Director for Stepping Up in our Behavioral Health Division. And not on this list, we also have Audra Goldsmith, our Project Manager for Stepping Up, and she lives in Kansas. And we also have three folks with us from the core agencies that are leading this work. So we have Clay McCarter from the Kansas Department of Corrections. We have Destiny Gillian from the Kansas Department of Aging and Disabilities. And we have Brenda Soto from the Department of Children and Families. And I'll turn it over to Clay to share a few words about the initiative.
Well, good afternoon, everybody. Again, my name is Clay McCarter. I'm the Director of Special Projects for the Kansas Department of Corrections. And we're excited that you all took some time out of your day to jump on the webinar today. We hope you guys learn a lot. And just to kind of give you a brief introduction to the project and to the initiative itself. Stepping Up, just really in a nutshell, looks at reducing the over incarcerated population of those with severe mental health issues. And so this was a work that began in Kansas several years ago, but was really just solely focused on the adult system. And it wasn't until really sometime last year that the discussion began as to whether we could take that adult model and craft it into the juvenile justice system in Kansas. And so those conversations really started to begin with a CSG and then with some of the other state agencies within the state of Kansas. And so I think it was December of last year, we entered into a 3-year contract with the Council of State Governments to really begin this work in Kansas. And so we're very excited about that. We're about 7 or 8 months into the project at this point. And so we have 3 core agencies that are really leading the work. That's the Kansas Department of Corrections, KDADS, and DCF. And so we've been working on building partnerships around the state. We have 2 task forces, a local and a state, that have been hard at work and already meeting this year to begin this work. And so we're very excited about the possible changes and really improvements that we can make in Kansas. And so I think that's probably enough for me. I'll pass it over to Destiny with KDADS and let her speak.
Thank you, Clay. Hi, everybody. Thanks for being here with us today. We at KDADS are thrilled to partner with KDOC, DCF, and CSG on this critical work for our youth. My name is Destiny Gillian. I am the Justice Involved Services Coordinator for the Behavioral Health Services Commission at KDADS. At KDADS, we have been working hard to implement behavioral health supports for our young Kansans and are eager to advance our efforts and create specific solutions for youth that experience the justice system. This initiative will help us understand what we have, what gaps exist, and how we can strengthen our behavioral health supports and cross-system partnerships to ensure youth are served effectively in the community as much as possible. We at KDADS have been investing in a range of behavioral health services for youth, including mobile crisis respite centers, community mental health centers, youth leadership, parent peer support groups, mobile competency and restoration services, services for youth with intellectual disabilities, and so many others. This gives us a strong foundation to build upon and know that our cross-system collaboration with DOC, DCF, and CSG will be a strong vehicle to serve youth with justice experiences more effectively. We are looking forward to identifying ways to strengthen our efforts, our collaboration, and advance positive outcomes for our youth in Kansas. So with that, I will turn it over to Brenda.
Hello, everyone. We really appreciate your time and your desire to learn about our initiative. I'm Brenda Soto. I'm the Director of Medicaid and Children's Mental Health at DCF. And I'm joined also in this work at DCF by Ashley Brown, who is our Crossover Youth Policy and Practice Coordinator. Currently, DCF, we're so excited to partner on this cross-system and innovative practice. We look forward to the years ahead. The work that we're building on is our current efforts to serve crossover youth and family in the community and leverage programs such as our Family Resource Center, our Family First, and our Family Preservation Services, along with others. And we're doing this while using our cross-system partnerships to work more effectively with youth across the state. Again, thanks for investing your time and energy in hearing about this project and the critical work that we're doing for our youth. We know that these are going to make tangible differences for our Kansas youth. So with that, I'm going to pass it on to Stephanie at CSG.
Thanks, everyone. Appreciate your enthusiasm and your leadership on this important work. I'm going to actually pass it over to Megan, who's going to walk us through the first half of the webinar today.
Thanks, Steph, and thank you so much to our partner agencies involved in the project. We're really excited for everyone that's here today to hear about this work that we're doing together. Next slide, please. So as far as what we're going to cover today, we're going to talk in a little bit more detail about what Stepping Up is, how Stepping Up and the existing Stepping Up TA Center has looked in Kansas and the evolution of that work. We'll talk about where we're headed with the Juvenile Justice Stepping Up project, and then we'll conclude with questions and discussion. So one thing I will add is that there is a Q&A button down at the bottom, as well as the chat. If you have specific questions that you want to make sure we answer at the end of the webinar, please drop those in there, and we'll make sure we get to them towards the end as time allows. Next slide, please. So Clay alluded to this a little bit in terms of what Stepping Up is, and it is a national initiative that is focused on identifying, addressing, and reducing the over-incarceration of people with mental illnesses in jails. At a national level, it is a partnership between the CSG Justice Center, the National Association of Counties, NACO, and the American Psychiatric Association Foundation. And it started about 10 years ago. Next slide, please. And really the things that led to the creation of Stepping Up are many of the things that sadly still exist today, but certainly our Stepping Up counties and other counties around the country and states have made considerable strides in addressing these issues. But we know what was true about 10 years ago when Stepping Up started. So Stepping Up launched in 2015, coming up on our 10-year anniversary next year, is that, we have a disproportionately higher rates of arrest and longer stays in jail, higher rates of recidivism, and all of those things for individuals that have a behavioral health need that are entering the justice system. There's limited access to healthcare. There's limited availability of evidence-based practices. We've got higher or more criminogenic risk factors. Many of these things really compelled these partners that I just mentioned, CSG, NACO, APAF, and many others, to really get on board with creating this national initiative to help counties address these issues. Next slide, please. So, when we look at numbers of the 11 million bookings that happen in jails across the country, about 2 million of those involve someone with a serious mental illness. And so those numbers are a little bit older in terms of looking at a national study. But those numbers and the percentage of individuals coming into our jails across the country and in Kansas specifically are still similar to that. And we know that it continues to be a real issue that Stepping Up continues to address across the country and in Kansas specifically. Next slide. So when we look at Stepping Up as a whole, it is a national initiative that is in over 580 counties around the country and across 45 states. 48% of Americans, we estimate, live in a Stepping Up county. And of those counties are really committed. So those 580 plus counties have indicated their commitment to addressing and reducing their jail population for individuals that have serious mental illness and other behavioral health needs through cross-system collaboration, alternative crisis response, diversion initiatives, and equitable access to services. So that's really the nuts and bolts of Stepping Up, is getting cross-system partners together to tackle this issue. And I'll talk a little bit more about that in a moment. We have 5 states that have launched a statewide Stepping Up initiative, including Kansas, and 40, actually close to 50 innovators that are really counties that represent, they're really leading the way within our Stepping Up counties that are really doing advanced data work. They're looking and seeing how they can improve their systems using data-driven decision-making and so forth. Next slide. So to really kind of distill Stepping Up down into a little bit of a flow chart here, what happens with Stepping Up is we start with county commissioners typically passing a Stepping Up resolution. At that point, those county commissioners and those cross-system partners, so behavioral health, criminal justice, and other partners that are really important at the table, have determined that they are going to collectively work on tackling this issue together. At that point, there is typically a cross-system council or a work group that gets convened, a Stepping Up work group, Stepping Up council. If you've seen these counties in Kansas, many of them have this operational, and typically there will be a coordinator or a point person that's really running the show with those councils. And what those councils or cross-system work groups do on the county level is they review data together. They start having conversations about what is our data telling us about our jail bookings, for instance, about our, individuals that are coming in with serious mental illness. What's our prevalence numbers look like? How can we start to address those? What sort of programming needs do we have? So that council will sit there and look at that data together. And the idea is that this is a cycle that doesn't end, really. It's supposed to be sort of iterative over time. So you've got this body that continues to look at things over time and problem solve together. So ideally, you're using that data to not only drive your decision-making in terms of local policies and practices, but you're using that information to determine what sort of funding you need and how can you identify and secure funding. And then, of course, measuring program success and determining what needs to be addressed within your county. And then continuing to collaboratively use that data to drive decision-making and pursue funding over time. As I mentioned, this is supposed to be a continuing non-ending cycle where this work group continues to work together. So we have Stepping Up counties around the country that started 9 years ago that are still operational doing this work. We have some that have just come on board that are recently sort of maybe at the beginning stages of things. And that's really kind of the life cycle of Stepping Up. Next slide. So how does this pertain to Kansas? So Kansas is the 5th state in the nation to launch a statewide Stepping Up initiative and the 2nd to launch a statewide Stepping Up TA Center. So the statewide TA Center originated back in 2020. And if we can go to the next slide and go into a little more detail with that. So there was a legislative post-audit study done in about 2018 that revealed that there are some serious gaps in service related to individuals with mental health and serious mental health and behavioral health needs in county jails around Kansas. And so KDADS decided to really look at what options and models are out there and available to us to really address this issue. And they embarked on this Kansas Stepping Up TA Center. So they partnered with CSG to launch the TA Center in 2020. And so it's been operational since then. And many individuals on this call might know that Audra Goldsmith, our project manager, runs that TA Center and has been for several years now. And she's located in Kansas. Next slide. So what is a Stepping Up TA Center? So I mentioned and walked through the Stepping Up framework and sort of the guiding principles and how Stepping Up works at the county level. Stepping Up is a county level initiative, but several states, as I mentioned, have bought into making it really a part of the state infrastructure, and Kansas is one of those. So the state TA center, what is unique about that is that it allows counties within Kansas, and we've got one other TA center that CSG operates in Pennsylvania, that it allows counties across the state of Kansas to have direct access to experts and individuals that can help answer their questions and provide individualized guidance around data and how to use that data to drive their decision making, how to really dig into their policies and practices to see what's working, what's not working. So there's really three main functions of the TA center: helping counties identify and address the behavioral health needs of individuals encountering their local justice systems. So starting to implement screening and use that screening to really look at prevalence numbers. The other aspect of the TA center is that we're building capacity. So we know that not all counties across the state of Kansas, and certainly not all counties across the country, have the capacity to collect and utilize data in the same way. There are some high capacity counties, some counties that don't have as many resources and et cetera. And so we really want to meet counties where they are. And that's what the TA center does. Sits with each county and says, okay, what are you working with? What capacity do you have? What skills do you need? How can I help you? And so forth. It's really individualized. And then the third piece of it is about that cross-system collaboration. I mentioned that we've got that cross-system from behavioral health and criminal justice, and we bring those partners together and provide technical assistance and support to make sure that counties have what they need. So that is what a TA center looks like and what it's looked like in Kansas. We can go to the next slide. So within Kansas specifically, we have currently under our Kansas Stepping Up Technical Assistance Center that is more focused on the adult side. We currently have a staff person that's a direct point of contact in Kansas that provides training, one-on-one technical assistance, webinars, et cetera. And they also do peer connect. We facilitate peer connections with sites across the country and around, and in Kansas specifically, to make sure that if one county is struggling with something, let's make sure we not only provide them with resources and guidance, but we also connect them with counties that might be able to support them. So there's a lot of that peer learning within the TA center. They have direct access to national experts, both on our team and the folks that you see here in this room, virtual room, and within CSG across the country to really support with different aspects of stepping up. And then really providing and infusing high impact strategies within different counties. So talking to counties about what they're wrestling with and helping to look at how they can best address that using best practices, evidence-based strategies, et cetera. Next slide. So when we look at stepping up Kansas by the numbers to date, we have 98 counties across the state of Kansas that have participated in our TA center activities, 37 of which who have directly engaged with the TA center in one way or another. And 22 counties have passed stepping up resolutions, which means they are in fact stepping up counties, 9 of which have become innovator counties, which again, as I spoke about earlier, are really leading the way. And proud to mention that Kansas has the highest number of innovators of any other state in the country. So we've been really grateful for that partnership with Kansas. Next slide. So Clay alluded to this, and so I'll keep this pretty brief so I can kick it back to Steph. But as Audra and others have been working in Kansas across the past several years, what started to happen is we started to hear that counties were saying, we really like stepping up. We're excited about what it does in our county, but we'd really like to see something like this for the juvenile justice system. So it was really those stepping up counties that voiced concern and interest in this. And that led to a lot of conversations that were had last year to figure out, okay, how can we get this thing standing up? And we're grateful for the partners, of course, that are in the room that agreed to be a part of that. So the focus moving forward is launching a juvenile justice stepping up framework and launching a juvenile justice stepping up TA center that Steph is going to speak about here in a moment. Next slide, if you don't mind. So Kansas is the first state in the nation to launch a statewide stepping up initiative for youth. So as I mentioned, we've got 45 states that are involved in stepping up on the adult side, and Kansas is the first to really take this model, take this framework, and see what we can do to adapt it to the juvenile justice setting. And as the program director of Stepping Up, I'm really grateful for that partnership and that opportunity to partner with Kansas in this way. And I will pass it over to Steph to walk us through this project specifically and what lies ahead for Kansas.
Thanks, Megan. Next slide. Yes, so the goal of this effort in Kansas is to strengthen community-based behavioral health supports for young people that are either experiencing the juvenile justice system or at risk of experiencing the juvenile justice system. And this includes things like strengthening cross-system collaboration, maximizing resources, really to ensure that young people are served effectively in the community as much as possible. And so to operationalize this goal, we have two key objectives, and we will work at both the state and the county level to ensure that both the state and the counties are really informing how this work moves forward. And to do this, we have two core bodies that guide this work. Again, one at the county, one at the state level, to really ensure that this leadership is happening across the state. And of course, we have the three core agencies that you heard from earlier today that are leading and guiding this work. And I'm going to talk about what this looks like over the next few slides. So as Clay mentioned, this is a 3-year partnership, and we have 3 key phases to help us meet these goals and objectives. So first, we have our first year, and as Clay said, we're already in month 7 or 8 of that year, and we're really looking to build the infrastructure and understand the landscape in Kansas. During the second phase, which is really next year, we are working to identify the key recommendations to really then implement a statewide action plan and support counties in implementing the new Stepping Up model for young people. And in the third year, we'll work to implement the juvenile justice Stepping Up model across all counties, focus on expansion, and ensure sustainability of any recommendations that come out of this work. And so the two main components that we'll talk about are really around reviewing the policies and adapting the Stepping Up framework to ensure that it is youth-centered, aligning policy and practices at both the state and county level. And I really can't emphasize the foundation of a state-county partnership approach is such a strong foundation for us to build on, to ensure that state policies are informed by local solutions that advance behavioral health outcomes for young people across the state. Next slide. And so, as I mentioned, this first year is really about building the infrastructure. So that included establishing the state task force and the local working group, which we call the Juvenile Justice Stepping Up. It's JJSU on the screen for short. And these two bodies are really guiding the initiative. The state task force is comprised of local and state officials to inform state level recommendations. And the local working group includes representation from a range of county stakeholders across the state to guide how recommendations will be implemented at the local level, including establishing the technical assistance center that counties can access and get ongoing support from. And I'll share more about this over a few more slides later. But in this first phase, we're conducting a statewide assessment that includes reviewing state policy, statute, data, court rules, funding mechanisms across a range of things like behavioral health services, juvenile justice processes, and cross-system collaboration. And in addition to reviewing these policies, we're also hosting listening sessions with a wide range of stakeholders across the state to understand practice at the local level, strengths, and identify opportunities for improvement. We already started reviewing our policies and mapping that state landscape and are conducting listening sessions starting this week. And here is a link that you can review the listening sessions and sign up for a listening session that fits within your expertise. So please visit that and fill that out. And then once we finish our policy review and the listening sessions, we'll work to synthesize this information, share the key findings and recommendations with the state task force, and work to build consensus on priorities for improvement and preparation for the 2025 legislative session. Next slide, please. So here you can see these are the folks that make up the state task force, which is guiding the state level work. And you can see this group represents a wide range of stakeholders that have critical insights and experiences with young people, ranging from elected officials, system leaders at the state and county level, law enforcement advocates, people with lived experience, service providers, and others. And so we really wanted to ensure that that can inform how Kansas can strengthen the behavioral health supports for young people that are experiencing the justice system at the state level. Next slide. And the Juvenile Justice Stepping Up Work Group is the local working group that will work to adapt and implement the Stepping Up framework for the juvenile justice system. And so in addition to having this first of its kind youth-centered Stepping Up framework, the JJSU will inform what data should be used to track local system performance and what kind of localized solutions can be utilized to promote cross-system collaboration within counties. Next slide. And here you can see the key stakeholders that are represented on the JJSU. So again, really vast range of folks ranging from law enforcement to people with lived experience, detention facilities, judges, service providers, court services, and others. Next slide. Next slide, please. Thanks. And so, as I mentioned, here are the listening sessions across the range of stakeholders. And oh, great. Thanks, Megan, dropping it in the chat once again to make sure, please sign up. It's open to anybody that is working in the field that's identified around that targeted group column across the 2 slides that we just had. We really want to make sure that we're hearing from folks in Kansas about your ideas for improvement, lift up models that are working really well to scale statewide, and understand just any other opportunities for improvement you all see for young people in Kansas. Next slide, please. And so here we have phase 2, which is really most of 2025. So after we have identified the priority recommendations, we'll work to support legislative and administrative policy change at the state level, and develop a detailed action plan to support adopting and implementing these new policy and fiscal changes. Also during this phase, we will launch a pilot of the juvenile justice stepping up model in counties, including disseminating guidance and resources like policies, funding, and practice updates, supporting pilot sites with the new framework implementation through site visits, peer learning, one-on-one technical assistance, and training opportunities. We'll work to set baseline measures and establish processes for ongoing data collection. We'll work to develop reporting templates to guide the statewide juvenile justice stepping up data tracking and reporting. And we will also work to draft and refine the statewide juvenile justice stepping up data report and dashboard. And I think critically, it's really important to for folks to know that we will work to establish information exchange between the local juvenile justice stepping up working group and the statewide task force to ensure that these 2 bodies are working collaboratively. There's information exchange, and we're leveraging all of the expertise across these 2 groups that are working, in tandem on improving outcomes for young people in Kansas. Next slide, please. And so this last phase here, critically, we will provide implementation support around the new policies to both state agencies and local counties. So through the state agencies, we will work to support them in implementing the action plan, define roles and responsibilities, and manage how the state agencies will roll out support to counties. Our Technical Assistance Center will be a critical mechanism to support all counties in implementing new approaches to serving young people with behavioral health needs in the community, including disseminating the Stepping Up framework, supporting counties through site visits, peer learning, one-on-one technical assistance, and developing data collection and reporting strategies, including a data dashboard to track performance and progress towards these goals. Next slide, please. And so in taking all this together, we anticipate that this work will result in enhanced collaboration across the youth serving systems in Kansas, including leveraging and enhancing the existing infrastructure of juvenile justice, behavioral health, and other youth services in the community, and really supporting the use of data to guide policy making and resource allocation decisions to ensure we are effectively responding to young people in Kansas. And so I just wanted to pause here, see if we have any questions. I noticed there aren't any in the Q&A, but I just want to leave some time for folks to drop some questions in the chat. See if there's anything else from any of our panelists that maybe I missed or you wanted to add. No questions from the group? So I'm surprised. Okay, I think I'm going to turn it over to Audra to talk through a few key things.
Yeah, thanks, Steph. So just doing this county level work with different people across the state, I start to get the question of, well, what is this going to look like in our county? When can we start doing JJ stepping up? How is this going to fit in? And so a lot of my communication with counties at this point is it's not a bad idea to just think about maybe how this would fit in your county. Some folks have talked about starting to incorporate more juvenile justice folks into their current Stepping Up Council, kind of in preparation for the future Stepping Up JJ framework. And some folks have started to think about if it needs to be a separate council and who could they start to get excited about this upcoming work in their counties. So I would just really encourage for those folks that might be in their Stepping Up councils in their respective counties that are on the call. If you haven't started talking about this in your Stepping Up councils, it really could be a good time to just let them know this work is going on if they're not aware, and start having those conversations of, can we start bringing people to the table, or does this need to be a separate meeting? How does it look like in your county? Stepping Up is very much DIY. It is very much county driven, and so it makes sense. However, it makes sense in your county. So I'll just put a plug in for that. People have really started to ask how to start getting involved in the JJSU work. So right now it's just that forethought and getting the excitement and the buy-in from your local stakeholders that are in that juvenile justice realm in your areas. So I will turn it back to you, Steph.
Thanks, Audra, and thanks for the question in the chat. I'll talk high level and then I'll turn it to Megan. So the question in the chat is, what are some of the obstacles or barriers that we have experienced? I'm assuming in implementing Stepping Up, and I'll say at least in the juvenile justice space, one of the things is usually around divert to what, or there aren't enough services. And so through this work, what we're doing is mapping the various funding streams, service availability, and access around, including rural area access and eligibility access, to then make sure that state funding and criteria are really enabling young people that either are involved in the justice system or at risk of involvement in the justice system are able to access these services, that services exist, and that counties have the funding and supports they need to implement the various service resources that young people are seeking. And so I don't know if Megan or Audra, you want to add to that around specifically Stepping Up?
Yeah, I mean, I think any county is going to have a different number of barriers and obstacles, and I'll let Audra speak to Kansas specifically. But it can involve any component. So when we talk about Stepping Up, there's sort of a framework that we use to walk counties through, and there's 6 questions that we ask counties to ask themselves. And it's about leadership buy-in and what data do we have and how can we use that data to drive decision-making. And really at any stage of that game, we can run into challenges. So for instance, if we're asking counties to really get at prevalence numbers or something like that, they can have a really hard time, for instance, implementing a screener or gathering that data you know, concretely, and, you know, whether it be electronically or using that information to, so they might even be able to gather it, but using that information to inform decision-making can be challenging. So I would say at any step along the way, there can be challenges that counties encounter. Which is why, you know, having someone like Audra or within the Stepping Up TA centers is really helpful, because there are, you know, different barriers that get encountered that can be tackled along the way. But I'm going to kick it over to Audra because she might have more specific examples she wants to share within the Kansas context. I know there's also that rural and frontier piece versus urban piece that we talk about quite a bit too, I want to touch on.
Yeah, sure. Thanks, Megan. Thanks, Steph. I think there are a couple of kind of those barriers that I'm thinking of when it comes to rolling out this stepping up work in individual counties. And the first and foremost is really forming those collaborations. So when you're trying to bring those people together around the table, it can be a lot of communication. It can be a lot of one-on-one communication to let them know, A, what stepping up is and why you are seeking this type of an initiative, and B, what their role really is within your stepping up council, and why it should be important to them. So I'm going to go back to that kind of how you want to get involved in stepping up, or just stepping up JJ in your county and start talking about that. Those are conversations that can start to be had, right? So that you've already kind of passed those barriers and jumped those hurdles when you are ready and when stepping up is ready to launch that JJ framework to Kansas. The other thing why it's good to start doing this forethought is to find those champions in your area. We all have been involved in or know of various initiatives, right? Either in Kansas or across the nation. And it really takes that champion, that person who is going to drive that work forward. And so identifying who that is in your area, in your community, is really important to keep this work going. And then I'll just add to that, people say, well, we want to do the work, but how do we do the work? What do we take information from to do the work, right? And so leveraging things like county or community assessments that happen, or if counties have walked through a sequential intercept mapping, somewhere where you can use good information to develop your strategic planning. I'll go back to data. Stepping Up is very data driven, and that can really inform strategic planning for counties. So the more that you can familiarize yourself not only with Stepping Up and the Stepping Up framework, who needs to be around the table and engage in those conversations, but also finding out what your county does and doesn't have when it comes to data. Have you done a SIM? Have you done a county assessment? You know, I would be shocked if you would come back and say mental health wasn't a high need in our county assessment. If you're one of those counties, please get with me and let me know what your trick is, right? Because it really is at the forefront of most of the counties in Kansas, and I think it could be safe to say across the nation. So finding out then what data is available in your area. And so data can be a very big challenge and barrier when it comes to not only the stepping up work, but JJ work, you know, adult juvenile justice or adult justice, criminal justice work. Our data is building and getting better, but it can continue to get better. So finding out what your county is capable of, finding out what your county fiscally is able to, you know, support as far as data collection and software management and things like that. Those are all really good things to know about and to have prepped for going into this type of an initiative to really make sure that it can be successful and that you can drive the work moving forward. I'll turn it back to you, Steph.
Thanks, Audra. Appreciate that. I just want to remind folks to please, if you have questions or comments, feel free to put them in the Q&A button. The chat is just, I think, disabled on the webinar function, so feel free to use the Q&A to share any thoughts or questions you have. And go ahead.
I was just going to add that I added a resource in the chat as helpful for individuals that might be interested in learning more about stepping up, and some of the information and details that Audra just provided. This is our framework or roadmap that we use for stepping up currently, that we are in the process of working through, adapting. And
You muted.
I muted myself, I know. That we are in the process of modifying and adapting for the juvenile justice setting through this project. So please take a look at that if you're interested in learning more about stepping up specifically, and certainly feel free to reach out to us, of course, as well. We're happy to answer questions as needed. Looks like we might have another question, so I'll turn it back to you, Steph.
Yes, so the question is about contact information for Brenda and Destiny. We'll share that information with folks as, oh, I guess I can just put it in the answer. Any other thoughts from our panelists on how you think the work is going so far, where you see the work going ahead?
I'll just say I've been very very excited about all of the participation and discussion that I've seen, even from the state task force and also the local work group. Been able to participate in a couple of those meetings so far, and just to see really just the high level buy-in and excitement to the work. And people, willing to, admit that, of course, we're not perfect. And of course, there are lots of things that we can work on. And then being willing to, take ownership of that and try to work through some of those issues. So just been really excited to see just the high level of participation and work that's being done so far.
Just to piggyback off of Clay, I came in pretty new into this role, probably about 5 months now. So just to see that the state of Kansas is adopting the original Stepping Up framework and then now going to the juvenile justice Stepping Up framework, I think it's very needed. I think it's a great initiative project to be a part of, and it is really exciting to see so much involvement, so much communication happen around this topic. So it's exciting.
Great. Oh, go ahead, Clay.
I was just going to say one of the common questions that I get about stepping up, and maybe it's just because we're so used to different programs and different initiatives within the juvenile justice system, is I think a common misconception of stepping up is that it is a program that we're going to put youth into. And that's not really not what stepping up is. Stepping up is not necessarily a program for the youth. It's almost a program for us as the workers within the juvenile justice system. It's more of a change of thinking and a change of in the way of doing business. And so I think that's one of the probably the most common questions I get is like, is this something that we put youth into? No, it's more for us in changing how we do business within the juvenile justice system.
Thanks, Clay. I think that's really an important framing, how this is really for us to help us organize our systems and services for young people to respond effectively to them. I see there's a question in the chat, a great question. How do we find out who's heading this program up in our county? And I'll turn it over to Audra.
Thanks, Steph. And I just want to piggyback on Clay's comment that really feeds into the one you just posed, Steph. But I think, as you think about stepping up and you think about the initiative, the way that I explain it to counties is that there are essentially two buckets of stepping up. It's very data driven, right? And on the other hand, it's forming those collaborations and breaking down those silos so that you can bring your county people together, your county policymakers together around a table and have sometimes difficult, but also strategic and positively disruptive conversations on how are we making these issues better. We all share mutual clients in the counties that you work in and cross county, right? And so it's really sitting down and saying, my agency can devote X, Y, and Z, or is excited to start X, Y, and Z service. This is how you can partner with me, and or this is how this type of service can affect your services. And we can collaborate and have better outcomes for the folks that we serve as a community. So it really is about sitting around a table making that and putting a lot of attention into what are we talking about? How are we making things better? And also how are we doing that data driven, right? So ways that you can get involved. If you're wondering if your county is a stepping up county, first and foremost, please email me, let me know that you're interested. Is my county doing this? And if they're not a formal stepping up county at this point, as I know the slide before mentioned, 37 counties is an average of counties that I talk to on any given quarter. So it can be higher, it can be lower. But depending on what county you're from, I can let you know this might be my contact person in the county that you are asking about, even if there might not be a stepping up county. These are the champions at least wanting to or interested in starting this work there. The other thing I would do is if you do have a criminal justice coordinator or any sort of a mental health task force or whatever your kind of behavioral health functioning body coalition might be called, reach out to them and ask, are we stepping up? Is this something you guys have looked into? Because typically the Stepping Up initiative will start and blossom out of one of those types of already existing coalitions or councils within an area. So my door is open, virtual door, email is always open. You can ask me, and I love to just connect people with folks in the counties that I have talked to. But also, you know, you can do your own research and ask if you do have those already existing behavioral health councils in your region to see if they've heard and how you can get involved as well.
Thanks, Audra. And just to, I think, add some of the key agencies that are usually involved on these councils, what the stepping up team, it's usually for at least, you know, when the youth side, when that comes out, it'll be the juvenile justice system, the local behavioral health system, DCF, like those are the three key agencies you're hearing from today. So if you have contacts within those departments at your local county level, I would say, you know, reach out there and see kind of who is the project coordinator leading that effort. And I believe the county's all public resolutions, right? And you can check that out on the website. There's a Stepping Up Together website that shows every county that has passed a resolution, and you can see if the county you live in or work in is a part of that effort. And there we have the link for the Stepping Up Together website there. Other questions from folks? And like it's listed in the chat, this will be recorded and up on the website, and we'll disseminate that to everyone that attended today's session. So please share widely with other folks that were not able to attend today. Just checking the chat. You can email me. My email is in the answer to Lucia's question, and happy to answer any other questions or connect you with other folks. Oh, and I see we have another question here. So from Jeffrey, says Leavenworth is having their first sim next week. Oh, that's super great. We're very excited to see how it can impact our stepping up process and gaining buy-in for the initiatives we're implementing. And just thanks, Audra, for all the support. So that's so great to hear. Yeah, so Crystal, yes, we'll be sharing the presentation. It will be on our website, and we will disseminate it to folks that attended today's session as well. And you'll also have the slide deck by itself will be up in addition to the actual presentation if you just wanted to go through the slides. Other questions? I appreciate everybody asking questions so far. That's great. And thanks for coming today. Anything else from folks on the panel? And there you can see that's all our contact information. So feel free to reach out to me, Megan, or Audra, and we will answer any questions you have. Last call for questions. All right, everybody. Thank you so much for attending today. We appreciate your engagement and participation in this work. We are super excited to make these improvements for our young people in Kansas and look forward to working with you around implementation. Thanks so much. Have a great day. Bye, everyone.